How you doing? I'm Dr. Raj with Goshen Family Chiropractic. Our wellness topic for today is inflammation. Inflammation is a buzzword in our health system in this day and age, and it gets thrown around a lot, and a lot of people don't know exactly what it is, what causes it, what to do for it. So I just wanted to take a few minutes, okay, and talk about inflammation. What is inflammation? Inflammation is a process that the body does to help protect itself from infections, illnesses, and injuries. And how it does that, it uses our immune system. So it uses our own body's immune system to help protect itself. Okay, and how it does it is through pretty much 5 cardinal signs. Okay, so the inflammatory process most likely consists of redness, an area becoming red, an area becoming hot, an area becoming swollen, painful, and loss of function or immobile. Okay, and I'll explain to you how it does that. So let's talk about a few examples. Okay, like I said, inflammation helps protect the body from illness, infection, and injury. So let's talk about infection. So say we have a sinus infection or some sort of skin infection. What happens is that area is going to become swollen. Now, why does our body swell up when we have some sort of infection? The blood vessels will dilate. Okay, when the blood vessels will dilate, the body's sending immune cells to help clear out any bacteria, any viruses, any pathogens in that area. Okay, it wants to send in immune cells, oxygen, good stuff to that area to get a lot of this junk out of there. Okay, now that area, when it gets swollen, it also gets hot. So you'll see it and it'll turn red. And then a lot of times it can become sore, tender, and painful because what the body's doing, it's going to actually protect it or protect us from overusing that area. And I'll get into more specific examples. Now let's talk about an illness. Okay, so say we get a cold or flu or we get sick. Okay, flu season's right around the corner. So what happens when we have some sort of cold or flu? Okay, our sinuses, we get congested. Okay, what happens is our blood vessels and our sinuses will inflame. Okay, again, that's bringing immune cells, oxygen, new cells to help get rid of any bacteria or viruses or pathogens in that specific area. Our mucus, so if we're blowing our nose a lot, okay, runny nose, our mucous membranes will actually secrete a lot more fluid, again, to get rid of those bacteria or pathogens in that area. So again, illnesses, infections, and then injuries. Okay, specific injuries, say we sprain our ankle. Okay, an ankle sprain or a knee sprain. What happens? Our ankles will swell. Okay, that area will get hot. Okay, it will look red, and then it will become painful. Again, the reason why a sprained ankle feels painful is because the swelling of that area is going to irritate the nerves. The nerves being irritated is going to send a signal to our brain, and our brain's going to be like, okay, let's make it painful so we don't put more pressure on it, okay? So the area can heal, okay? The inflammation process or the swelling of the blood vessels are going to bring in new cells, bring in oxygen to help flush out the damaged tissue that was created from the ankle sprain. And that can happen anywhere. That can be in our shoulders, our knees, our hips. When things are tender, sore, painful, we know that there's some sort of inflammatory process going on, okay? And the body's actually trying to help heal itself naturally through this process. Okay. Now, this process is good short term. Okay, so this is what we call, a lot of that stuff is good in an acute process or short-term process. Okay, the acute inflammation is good. That's a good defense mechanism by our own bodies to help it protect itself and help heal itself. However, when this turns chronic, is not good. Okay, when chronic inflammation starts to settle into our bodies, that's not a good thing, because a lot of things go untreated. So an untreated infection, an untreated illness, an untreated injury can turn chronic. And that's where we're seeing most of the long-term autoimmune problems, chronic disease, heart stuff, digestive stuff, reproductive stuff. It's because the acute system is no longer acute and it has turned chronic. Okay, and this is what we're seeing a lot more in today's day and age. Okay, so if you see a diagnosis that ends with itis, I got the itis, okay, whether it's gastritis, tendinitis, colitis, arthritis, these are all problems that have been there for a while. These are all chronic inflammatory responses, and the name just suggests where in the body that's happening. Okay, so how do we help heal chronic inflammation? Okay. So if the problem is, say, a musculoskeletal problem, whether it's tendinitis, bicipital tendinitis, chronic knee pain, chronic ankle pain, chronic back pain, chronic head pain, there's usually some sort of acute inflammatory problem going on because things are tender, sore, and painful. One of the cardinal signs. So there's a bunch of things that we can help to help rehab that area, whether it's chiropractic care, adjusting different joints in our body, the spinal cord, the joints in our back, rehab, whether it's PT or continuing chiropractic care, functional exercises, functional movement patterns, and just even rest. Okay, will help heal that inflammation within the musculoskeletal system. If it's an organic issue, so organic meaning systemic, chronic heart disease, chronic autoimmune problems, diabetes, digestive issues, inflammatory bowel disease, then we got to figure out, okay, what's actually triggering the immune system from keeping this thing chronic. Okay, there's something going on that's keeping the immune system active, and it's starting to actually turn against us and attack our own tissues and our own cells. So it's important that we do all of the tests, the blood tests, stool tests, any labs, to understand, okay, what inflammatory markers are creating the organic chronic disease process that's occurring. Okay. Now, a big factor, what I see, and which goes hand in hand with a lot of chronic inflammatory processes, is chronic stress. Okay. Chronic stress is a big one, because when we're under stress 24/7, 365 days a year, our bodies never get a chance to heal and repair. Okay, so a lot of the invaders, the pathogens, the bacteria, the viruses aren't being able to be flushed out of our system, and that's keeping to trigger our immune system to create that inflammatory process. Okay, so it's important that we're able to manage our chronic stress. And there's many different ways to manage chronic stress. Going outside for a 10-minute walk at lunch. Exercise. Exercise is the number one most way to help with stress. Meditation, yoga, chiropractic care, good quality sleep. drinking good, clean water, avoiding processed foods, not consuming a ton of sugar. A lot of those things are going to help deal with chronic stress because you're allowing the body to heal, repair, regrow, renew. Okay? And ultimately, that's going to reduce the chronic inflammation within our body. Okay? So, if you have any questions, post, comment. You have any specific question, just message us through Facebook, check out our website, and we'll be able to answer any questions, okay, that you may have. Until next time, I'm Dr. Raj from Goshen Family Chiropractic. Have a good one.